Hi everyone, my name is Sylwia Kozak and I am a teaching assistant 1 in PPCR program this year. Today I'll be discussing a critical issue in clinical research, which is missing data, its implications and strategies for managing it effectively. Let's delve into what missing data actually means and its various types in clinical research. So, missing data refers to the absence of data values in a dataset that were intended to be collected. The nature of missing data is categorized into 3 types. The first one, missing completely at random. Here, the reason for missing data is unrelated to any study or participant characteristics. For example, if a survey response is lost due to a technical error. The next one is missing at random. In this case, the propensity for data to be missing is related to observed data. For instance, younger participants may be less likely to follow up. And the third one, it's missing not at random, and the missingness is related to the unobserved data itself, like participants dropping out due to adverse effects. Understanding these distinctions helps in choosing the right method for analysis. Let's consider the significant impacts of missing data on the validity of clinical research findings. Ignoring missing data can gravely affect the validity of clinical research. Bias. So inaccurate estimates might lead to misleading conclusions, especially if the missing data is systematically different. Loss of power. Statistical power is diminished, potentially leading to type 2 errors, failing to detect an actual effect. And increased errors. Both random and systematic errors can inflate, compromising the study's conclusions. Hence, addressing missing data is not just beneficial, but necessary for accurate results. Next, we will explore some common sources of missing data and discuss how they can be mitigated. Missing data can stem from various sources. First one, patient dropout. This could be due to side effects, lack of perceived benefit, or personal constraints. Implementing regular engagement strategies can mitigate this. Second one, loss to follow-up. Often due to logistical issues, improving follow-up methods can help. And non-response. Certain questions may be perceived as intrusive or sensitive. Anonymizing responses and assuring confidentiality can increase response rates. Recognizing these sources allows for more effective preventive measures. Now let's discuss the proactive strategies we employ to manage and mitigate missing data effectively. To tackle missing data, we employ several approaches. So it can be the prevention strategies. By refining study designs and participant engagement, we can reduce the incidence of missing data. The next one, imputation methods. Techniques such as mean imputation, multiple imputation, or regression imputation help fill in missing values based on available data. And the most important, sensitivity analysis. This technique tests how sensitive our results are to the assumptions we make about the missing data, ensuring robustness. These strategies collectively help in maintaining the credibility of our research findings. Now, let's take a look at a practical example from a clinical trial aimed at evaluating a new cardiovascular drug. In this trial, we encountered significant missing data when several participants discontinued due to side effects. This scenario, around 20% of the data was missing because participants experienced adverse effects and chose to leave the study early. This missing data was missing not at random, and it related to the severity of side effects, which was unobserved for those who left. Next, I'll detail the specific strategies we used to address this missing data in our case study. So, we used multiple imputation. We employed multiple imputation, which allowed us to handle the uncertainty about the missing data by creating several different imputations and pulling the results. And sensitivity analysis, We conducted a sensitivity analysis to assess how assumptions about the missing data influence the trial's conclusions. This involved analyzing scenarios where participants who dropped out had worse, similar, or better outcomes compared to those who completed the trial. Let's look at the outcomes of the strategies we implemented and the insights gained from the trial. After applying these strategies, the revised results showed that while the drug effectively reduced cardiovascular risk, it did so at the potential cost of increased side effects. This understanding helped in making informed decisions about further drug development and provided clear guidance on patient safety monitoring for future trials. This case illustrates the importance of thoughtful strategies in managing missing data, ensuring that our conclusions are robust and reflective of true effects of the treatment. In summary, while missing data is an inevitable part of clinical research, understanding its types, impacts, and effective management strategies is essential. Proactively addressing missing data not only enhances the validity of our findings, but also ensures that our research can inform medical practice and policy. Thank you for your attention. I welcome any questions you may have now and thoughts you'd like to share later. Please feel free to reach out to me directly if you have further inquiries or need clarification of any of the discussed topics.